7. Deep breath and pull. 1, 2, 3, 4, 5, 6, 7. Good.
Hi, Leona.
Hi.
So, Leona, you're here to start your procedure with Dr. Robert Davis.
Yes, I am.
You came to us a while back.
Yes, I did.
And how'd you hear about us?
Over the TV.
On the TV. And what made you come in to see Dr. Davis?
Because I liked the way the people was getting better after he treated them. Seemed like it helped me, so I decided, well, I better go see if he can help me.
Did you see another doctor?
Yeah, I saw orthopedics and neurologists and some everybody.
What are they telling you?
Knee replacement,
Ugh.
shots, and all of that. And I tried the shots, but I couldn't take the whole series. I was getting a bad side effects, didn't do me any good.
Oh,
So I
so
stopped
bad
it.
for your body.
And I wasn't going to have knee operation because I saw too many people that had it and it didn't work.
All right. Well, I want to try a couple different specific movements to see where we're starting, where you hurt, so Dr. Davis can have a good starting point, and then we'll see how you're doing afterwards. So I see here you have a walker.
Yes.
What do you say about that thing?
I hate it.
I hear ya.
I hate it.
Let's see what we can do, because I've seen people come out of a wheelchair here, so let's see what we can do.
Okay.
I want you to try standing up. See what happens.
Dang it. Oh,
Oh, oh.
God.
What was your pain level doing that?
Oh, man, it went all the way up to,
It went up to 10?
yes.
Where did it hurt? Point to me.
Oh,
Point for me.
here and back here.
From the back.
And all back, all the whole.
The whole thing is just hurting for you. Now, I want you to try a squat, but I want you to stay where you're at.
Okay.
So just because if you fall right into the bench.
All right.
So put your hands in front of you, kind of get your feet a little bit apart. All right there. And then try to squat. Get as low as you can, and then try coming back up.
Oh.
Is that all you
Yeah,
got?
that's all I can
That's
do.
all you got. I'm not going to make you do more than that.
No, I can't.
How is this affecting your life, Leona?
It's helping me a whole lot. I can't do nothing that I normally would like to do.
We
Like,
were talking about some stuff
yeah,
inside.
cooking for my grandkids, going shopping, going to my religious meetings, working, doing the little flowers in the yard. I like to kind of have flowers
Gardening.
and stuff.
All right.
And I really like to clean my house and scrub things down real good. Can't do any of that. I can't even clean my refrigerator. Because of my knees. Let me
Your
sit down.
your face lit up with the idea of being able to clean your house.
Oh yes.
So that's something we're gonna work towards.
I hope so.
So I
hope
see you couldn't stand up much longer, so we didn't even try the stairs. Would you have been able to try that?
I'll try it.
You want to try it?
I'll try it to see.
Okay.
You know how bad I am.
Oh, all right. You're not gonna fall?
No.
Okay. You can use the rails.
No, I'm gonna have to get the stick to get there.
That's
See,
okay.
that's what I don't want. I don't want to have.
All
I
right.
don't want to have to do this.
You want to be independent from those
Like
things.
a toddler.
Now, if you find you can't make it down, don't even keep going, all right?
Mm-hmm. See now, oh Jesus. See now, this is what I would like to do. Just step down and step back up like something like a good
Right.
human being.
Let's try going back up.
Oh, if I can make it down.
If you can't, we'll go around the ramp.
No, we won't be because
Oh, that is very tough.
yes, it is.
Oh, wow. Thank you for trying.
Yeah, I want to lift it in my bed and I want to put that.
Well, Leona, we are going to get this procedure done and see where we are, okay?
Yes, darling, let's do it.
Awesome.
Yes, ma'am.
There you go, Leona.
Yes, ma'am.
That's what I'm talking about. Getting those knees bending.
Your muscles are just weak.
Yeah.
So once you get up and you're just weight bearing more, your muscles will get strong just from weight bearing. That's good.
Does it feel different?
Yeah, it's a little different. I couldn't do this before, even with the cane.
Yeah.
Pick up your legs like that?
Right. This helps better, I must say.
Good.
Anything else that's different?
Not hurting as bad.
Okay. Well, we're
just-
going to keep you walking and we're going to go right outside.
Yeah, keep-
All right, we're back with Leona. Leona's finished her treatment with Dr. Davis. So I'm going to have you stand up for me.
Okay.
How is that?
Much better.
Much better.
Better.
All right, let's try to do that squat again. That was one of your biggest problems you had before was that squat. There you go. Try to bend down. Bend those knees. Yep. Bend those knees. There you go.
As far as I can go.
Slowly come back up. How was that? What was your pain level there?
Hardly none. About a 4 maybe.
Wow, you went from a 10 plus to a 4? Yes. You want to try them stairs?
I guess I will.
All right. You just take your time, okay?
Okay.
We'll get you out of that walker before you know it.
I want to get out of that walker. Okay.
How was those stairs, Leona?
Much better this time.
Much better this time? It was a little bit easier for
A
you?
little bit easier. Remember before I had to hold both hands on the stairs?
Right, and so now you only had to use one hand.
Yep.
So what changes have you noticed? What is different from before you started?
I'm not as stiff in my knees and back, and my back doesn't hurt like it did before.
Good.
My knees move better.
Right.
I couldn't do this before.
And look at you. You have a determined look on your face, let me
Yes,
tell you.
Yes.
We haven't even done therapies yet. So some of the assisted therapies that we're going to be doing, they're going to assist with relief of pain, inflammation, and increase the blood flow in there. So we're going to go and we're going to start doing that. Are you happy with today's visit?
I'm very happy.
Yes. Welcome aboard.